Hi guys, Dr. Axe here. And I want to talk about Hashimoto's thyroiditis. It's what I was diagnosed with that really got me in the health sector. And for a lot of people, they're just trying to figure out, is that their problem or not? And for 80% of Americans, their thyroid condition is autoimmune related. Not necessarily Hashimoto's, but autoimmune related. And this is where it gets a little bit tricky because in some cases, I have patients where I'd say, hey, technically your Hashimoto's antibodies say negative, but due to your symptoms and your history and looking at your autoimmune system, I would consider you thyroid autoimmune positive. Okay. So I do like to look at everything, but more objectively, when you're doing the blood work, there's two antibodies, thyroid peroxidase and thyroid globulin AB. You do need to test for both of these. Okay. And if one of them is positive, you are considered positive. You also need to look at thyroid stimulating immunoglobulin, TSI, for Graves, okay? And what can happen is some people can be negative for one, they could go through this transition, negative, and then they could be positive for Graves. And you test for Hashimoto's, but really it's because you switch from hyper to hypo, and it's like you could teeter-totter back and forth, and when you're doing your testing, you could miss it. And that does happen with a lot of patients over time. So if you have autoimmunity going on, maybe those antibodies aren't positive, but your immune system might be playing a factor in damaging your thyroid or your other endocrine system or organs at the same time. So I hope that's not too confusing. I hope that helps you understand looking at that full picture. And that's one of the things I love to do with my patients is it's not always so simple as a test and a yes or no and a black or white. Sometimes you have to read between the lines. Sometimes you have to look at the history. You have to make an educated decision. And it's not as simple as looking at a blood work and saying yes or no. But a lot of times it is autoimmune, and those are the labs and the panels that you need to look at to make an educated decision. So I hope that helps create some clarity on whether you are autoimmune, Hashimoto's, thyroid positive or not. If you want to learn more, go to axholisticmedicine.com, hit functional medicine, hit that thyroid page. We have a lot of great information. Hit our integrative testing page to learn more about the tests that we do to figure out the cause of Hashimoto's and autoimmune conditions. Thanks.